Yeah, just a quick review of the ComfiLife knee brace. So this brace is made specifically for people that are having some kind of knee pain or problem with their knee. And the idea here is that you put on the brace, and it supports the joint and also the surrounding knee muscles and soft tissues, and also restricts the motion a little bit. So that way your knee has a chance to rest, recover, and doesn't get so overstressed as you're doing things. So a few points about this particular brace. It does fit the right or the left knee, so you don't have to worry about buying a right one or a left one. And that's a really good thing to do, I think, because let's say you had right knee problems, okay, and then after a while your knee got better and you didn't need any more, but then maybe one day you had the left knee problems. You say you don't have to buy another brace again. You've always got this one to use. It is made of breathable neoprene, which is good because people put these on mainly when they're out doing things, like if you're playing a sport or you're like gardening or that kind of stuff. And so, especially in the summer months, you start to sweat and then the brace gets kind of smelly. And then you have to worry about washing the thing. So it's always good to start out with a highly breathable fabric first. The other thing about this one is that it does have a little reinforced area here around the kneecap. It's, I guess, kind of like a reinforced kneecap stabilizer. So if you have any kind of trouble with your kneecap staying in place, like you had dislocations or you're just being pulled to one side, that's something else to consider. Got that little additional support around there. So anyway, other things you can do for your knee besides putting on a brace, there's a few examples from, this is from Bulletproof Your Knee. If you have any kind of knee problem, make sure you're doing at least one exercise for your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your leg here, and there's your kneecap, just for reference. It's basically key in stabilizing your knee. So if we're talking knee stability, you got to have really strong quads. What they're finding is people with various knee problems, probably about any problem you can name with your knee, I can probably show you a study where researchers are pinpointing you have selectively decreased quad strength. Doesn't seem to affect the other muscles, just the quads for some reason takes the hit. So for instance, knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have like an acute injury and you have swelling in the joint, or if you have chronic swelling, it's enough to decrease the strength of your quadriceps. Knee injuries in the quadriceps, say if you've broken like your lower leg bone, like your tibia, if you had prior surgery, like surgical opening of the knee joint, researchers find, hey, you probably have decreased quad strength. Ligament problems, ligaments hold the bones to the bones. So you have your ACL, your anterior cruciate ligament. Listen, this one study looked at people who ruptured their ACL, and they found the strength of their quadriceps muscle in the injured leg was decreased by 25 to 30%. So that's a whopper amount of strength just chopped from your quads. That really compromises your knee stability. So it's hard to get better and completely back on your feet and pain-free if you have that kind of deficit. Same thing with the posterior cruciate ligament, medial collateral ligament. They find your quads, just your quads really, are really have decreased strength. Knee pain. Here again, if you've had some kind of chronic knee pain, researchers find your quads are usually weak. Knee arthritis in the quadriceps. So this is interesting. And you can Google like knee arthritis and quadriceps. Just basically every study that I know of shows that you have decreased, if you have knee arthritis, you have decreased strength in your quadriceps muscle. And so likewise, they find there are randomized controlled trials showing that if you take a bunch of people with knee arthritis and you strengthen just their quads, their knee pain starts to go away. And the other thing they find is that if you take a bunch of people and you look at their knee arthritis and their quadriceps strength and you follow them over time, the people with the strongest quads actually have the least progression of their knee arthritis. So it actually kind of interrupts the whole pathological process. It doesn't take place as fast. So definitely a lot of reasons if you have knee arthritis to strengthen your quads. Patellofemoral pain syndrome. I mean, this just goes on and on. Any kind of knee trouble, even if you have knee pain and you don't really know what's wrong with it, definitely strengthen your quads. Fine-tune control over your knee. Here they're talking about the hip muscles. Sometimes you have a knee problem, but there's really nothing wrong at all with your knee. The problem's up at the hip. Classic case is iliotibial band syndrome. And so what they find, they take a group of people with iliotibial band syndrome, find these people have unusually weak hip abductors. Your hip abductor muscle, like your gluteus medius muscle, it's key in keeping your pelvis level. And bringing your leg out to the side. And here again, just like knee arthritis, take a group of people with iliotibial band syndrome, and these are randomized controlled trials showing this. Strengthen their hip abductors, iliotibial band syndrome starts to go away. So, something else to consider. Optimize knee flexibility. We all know we need a flexible knee that bends and straightens. What a lot of people don't know is that your knee doesn't just bend and straighten, it also rotates. Yes, your knee does rotate. About the last 10 to 15 degrees of you straightening your leg out fully, your knee actually rotates uh, out to the side laterally. And here's a little test to see if you have that motion. So that's an accessory motion that your knee has to have in order to be fully functional. So something else to think about. Increasing dynamic knee stability. Here they're talking about proprioception. Proprioception is your position sense. So if I suddenly turn off the lights, you'd be able to tell me whether your knee is bent or straight. That's because you're getting constant feedback from your joint receptors and the nerves and the receptors around in your muscles around your knee. They're constantly giving your brain feedback as to where your knee is in space. What they're finding now is people with various knee problems, their proprioception isn't what it should be. So it's not like these people don't know where their knee is, but it just is not what it should be, which plays a role in things like your reaction and your reflexes. Like for instance, if you step off a curb and you need to know, oh, where's my knee? Okay, I haven't hit the ground yet. And that way your muscles can contract and brace it for when you just kind of pound down. So it has a lot to do with that kind of stuff as well. Anyway, other things you can do for your knee, but hey, nothing's as quick as putting on a brace. A lot of people report that they get kind of instant pain relief as they're wearing it. So that's a good brace. Check it out.